Health promotion and community health nursing. Since its inception, nursing has focused on helping individuals, groups, and communities maintain and protect their health. Florence Nightingale and other nursing pioneers recognized the importance of nutrition, rest, and hygiene in maximizing and protecting one's state of health. Although people are responsible for their health and medical care, they often seek advice from nurses in the community regarding health promotion and to help them make sense of the many and often competing recommendations that appear daily on TV, online, in newspapers, and in magazines. Green and Creator of 1991 defined health promotion as any combination of health education and related organizational, economic, and environmental support for behavior of individuals, groups, or communities conducive to health. Parse 1990 states health promotion as behavior that is motivated by the desire to increase well-being and to reach the best possible health potential. Health protection refers to behaviors in which one engages with a specific intent to prevent disease, to detect disease in the early stages, or to maximize health within the constraints of disease. Immunizations, which protect against specific diseases, and cervical cancer screening for early detection are examples of health protection activities. Oletnov 2002 defines risk as a probability that a specific event will occur in a given time frame. A risk factor is an exposure that is associated with a disease. There are known risk factors for some diseases such as smoking and its association with lung cancer and high blood pressure and heart disease. Some risk factors are assumed such as exposure to cell phone radiation and brain tumors. There are three criteria for establishing a risk factors. The frequency of the disease varies by category or amount of the factor. Cigarette smokers are more likely to develop lung cancer than non-smokers, and those who smoke heavily are more likely to develop lung cancer than those who smoke little. The risk factor must precede the onset of the disease. Cigarette smokers have lung cancer after they have been smoking for a while. If a smoker had lung cancer before starting to smoke, this would cast doubt on smoking as a risk factor for lung cancer. The association of concern must not be due to any source of error in any research study. There are many resources of error such as study design, data collection, methods, and data analysis. Other criteria that have been noted in literature include strength of the association, consistency with the repetition, specificity, and plausibility. In order to determine health risks to individuals, groups, and populations, a risk assessment may be conducted. A risk assessment is a systematic way of distinguishing the risk posed by potentially harm exposures. The four main steps of a risk assessment are hazard identification, risk description, exposure assessment, and risk estimation. The relationship of risk to health and health promotion activities. Health is directly related to the activities in which we participate, the food we eat, and substances to which we are exposed daily. Our gender, age, genetic makeup, and environment in which we live also impact health. In the assessment of risk regarding health and health promotion activities, there are two types of risks: modifiable risk and non-modifiable risk. Modifiable risk factors are those aspects of health risk over which an individual has some control. Examples of modifiable risk factors include smoking, a sedentary or active lifestyle, type and amount of food eaten, and type of activities in which one engages. Non-modifiable risks are factors are those aspects of risk over which one has little or no control. Example includes genetic makeup, gender, age, and environmental exposures. A useful tool to help clients assess their family history for possible health risks is available. This assessment is easy to use and can create a dialogue between family members to discuss family health history. As the nurse assesses the various aspects of a health of a client, it is important to evaluate behaviors that have a positive effect on the client's health, not only those behaviors that are detrimental to health. Healthful behaviors, such as maintaining an exercise regimen or following an eating plan, build self efficacy and self esteem. Positive health behaviors also provide a foundation on which a nurse can build on to address unhealthful behaviors. If a client has been successful at smoking cessation, the confidence and self-efficacy learned from this change can be drawn upon to help the client stick to a low-sodium, low-fat diet to address hypertension. Risk reduction is a proactive process in which individuals participate in behaviors that enable them to react to actual or potential threats to their health. Risk communication is a process through which the public receives information regarding possible or actual threats to health. Today, individuals, groups, and communities receive information on health risks from many sources beside healthcare professionals. The internet is a new source of risk communication for many community members. Newspapers, periodicals, radio, TV, and billboards are long-standing sources of health information in public health. Although there are many sources of information on health risks available to the public, quality varies widely in the accuracy of the information presented. Although its purpose is information dissemination so that people can participate in risk reduction, risk communication is affected by the way individuals or communities receive, process, and act on their understanding of risk. In 2009, about 52% of the deaths in the Philippines were attributed to conditions related to lifestyle factors, diseases of the heart, cerebrovascular diseases, malignant neoplasm, chronic lower respiratory diseases, and diabetes mellitus. Diseases of the heart were stated as a cause of 21% of all deaths in the year. Diet and health. Diet is one of the most modifiable of risk factors. A healthy diet contributes to the prevention of chronic diseases such as type 2 diabetes, hypertension, heart disease, and some cancers. The problem of being overweight and obese in the country is alarmingly increasing in number, affecting about 7 out of 10 women and about 1 out of 10 men. Obesity affecting Filipino adults is known as the android or apple-shaped type, where abdominal fat accumulation is were measured using waist to hip ratio. The waist to hip ratio criterion recommended by the World Health Organization is considered as a sensitive measure for risk to cardiovascular diseases. A person with a WHR equal to or more than 1.0 in men or equal to or more than 0.85 in women is considered android or apple-shaped obese. The relative risk associated with apple-type obesity among Filipinos was found to be more than twice the risk of developing coronary artery disease and almost thrice the risk of developing cardiovascular diseases including stroke. Nutritional guidelines for Filipinos. Eat a variety of foods every day. Breastfeed infants exclusively from birth to 4 to 6 months and then give appropriate foods while continuing breastfeeding. Maintain children's normal growth through proper diet and monitor their growth regularly. Consume fish, lean meat, poultry, or dried beans. Eat more vegetables, fruits, and root crops. Eat foods cooked in edible or cooking oil daily. Consume milk, milk products, and other calcium-rich foods such as small fish and dark green leafy vegetables every day. Use iodized salt, but avoid excessive intake of salty foods. Eat clean and safe food. For a healthy lifestyle, a good nutrition, exercise regularly, do not smoke, and avoid drinking alcoholic beverages. There are many reasons people engage in physical activity and exercise to achieve weight management, increase energy, better appearance, to fit into a favorite clothes, to prevent development of worsening of a chronic health condition, to manage stress, to improve mood and self-esteem, or any combination of these reasons. The Clean Air Asia has developed a tool to rate Asian cities for suitability for walking. The parameters applied in the walkability survey are the following: walking path modal conflict, the extent of conflict between pedestrians and other modes on the roads such as bicycles, motorcycles, and cars, availability of walking paths, the need, availability, and condition of the walking paths, availability of crossings, the availability and length of crossings to describe whether pedestrians tend to jaywalk when there are no crossings or when crossing are too far apart. Grade crossing safety, the exposure to other modes when crossing roads, time spent waiting and crossing the streets, and the amount of time given to pedestrian cross intersection with signals. Motorist behavior, the behavior of motorists toward pedestrian as an indication of the kind of pedestrian environment. Amenities, the availability of pedestrian amenities such as benches, street lights, public toilets, and trees, which greatly enhance the attractiveness and convenience of the pedestrian environment and in turn the surrounding area. Disability infrastructure, the availability of positioning of and maintaining or maintenance of infrastructure for the disabled. Obstructions, the presence of permanent and temporary obstructions on the pedestrian pathway. Security from crime, the general feeling of security from crime on a certain stretch of road. Research has found that one's environment is a significant factor in health promotion. Adults and adolescents living in neighborhoods with high walkability engage in significantly more walking and cycling than those living in neighborhoods with low walkability. How much exercise do I need? What counts as exercise? Nurses in the community hear these questions commonly as they educate the public on the need to increase physical activity. The answers to these questions will depend on the age, physical condition, and gender of the client. People may feel overwhelmed by the idea that they must add one more demand to an already busy schedule, and some think, I'm in such bad shape, I'll never be able to exercise. The most important idea is that one must take a first step to try exercise: walking, biking, taking the stairs, swimming. There is something for everyone, and any exercise is better than none. Exercise may also be broken down into smaller blocks of time during the day if it's not possible or convenient to do it all at once. Physical activity can also be a family affair, with the entire family using the time to reconnect and have fun together. Of course, people or persons with health problems such as cardiovascular condition should seek guidance from the health worker. Sleep. Sleep is an essential component of chronic disease prevention and health promotion, yet 74% of adults report having a sleeping problem one or more nights per week. Insufficient sleep is associated with diabetes, heart disease, obesity, depression, or motor vehicle accidents. Sleep requirements change as people age, and depending on life circumstances, one may require more than the minimum hours listed. If a person is so tired or sleepy that it interferes with his or her daily activities, that person probably needs more sleep. Practicing sleep hygiene will help achieve optimum sleep. Number 1, avoid caffeine and nicotine close to bedtime. Second, avoid alcohol as it can cause sleep disruptions. Third, retire and get up at the same time every day. Fourth, exercise regularly but finish all exercise and vigorous activity at least 3 hours before bedtime. Fifth, establish a regular, relaxing bedtime routine. 6. Create a dark, quiet, cool sleep environment. 7. As much as circumstances allow, have comfortable beddings. 8. Use the bed for sleep only. Do not read, listen to music, or watch TV in bed. 9. Avoid large meals before bedtime. Sleep assessment is an important nursing function. If patients report snoring, apnea, restlessness, or insomnia, they have sleep disorders. Recommend keeping a sleep log detailing how many hours are spent in sleep each night and any problems with sleep. If insufficient sleep is causing trouble concentrating or completing daily activities, recommend consulting a doctor as a sleep disorder may be to blame. Tobacco and health risks. Smoking cessation is an important step of achieving optimum health. Based on the result of the Global Adult Tobacco Survey of 2009, it is estimated that more than half of the world's smokers live in 14 countries, the Philippines among them. In 2009, among the 10 leading causes of death in the Philippines, 8 were associated with smoking. The economic impact is estimated at 1% to 2% of gross domestic product spent for tobacco-related disease, lost productivity, and death. The cigarette smoking prevalence rate of Filipinos aged 15 years and older was 28%. 48% of the male and 9% of the females were current smokers in the same year. In 2007, among students aged 13 to 15 years old, tobacco use have a prevalence rate of 22.5%. Boys have a prevalence rate of 23.4%, girls 12%. Among previously daily smokers, 21.5% quit smoking. Among current cigarette smokers, 60.6% report they would like to quit smoking. Smokers who are trying to quit experience withdrawal symptoms such as anxiety, increased appetite, irritability, and difficulty concentrating. These symptoms make quitting difficult, and most people will relapse several times before being able to quit successfully. Nicotine replacement, pharmaceutical alternatives, hypnosis, and acupuncture may be helpful in the attempt to quit smoking. The American Cancer Association recommends the following steps to quit smoking. Make the decision to quit. Any change is scary, and smoking cessation is a big change requiring a long-term commitment. Set a date to quit and choose a plan. Mark the date of your calendar. Tell your family and friends about the date and ask for their support. Get rid of all tobacco products, ashtrays, and lighters in your environment. Stock up on oral substitutes such as sugarless gum, hard candy, fruit, and carrot sticks. Decide on a plan and prepare to implement it. Register for a stop smoking class or see your doctor about nicotine replacement therapy or pharmaceutical alternatives. Practice saying no thank you, I don't smoke. Think back to your previous attempts to quit and see that what worked and what did not work. If you are taking bupropion or varenicline, take your medication each day of the week leading up to your quit day. Deal with withdrawal through avoiding temptation, changing your habits, walk when you are stressed and during breaks. Use hard candy, carrot sticks, or gum to satisfy the need to put something in your mouth. If you feel the urge to light up, tell yourself that you are going to wait 10 minutes before giving in. Usually, the urge will pass within that time. Staying off of tobacco is a lifelong process. Many former smokers state that they experience strong desire to smoke after weeks, months, even years of smoking cessation. This unexpected craving can be difficult to deal with. Remind yourself of the reason you quit. Wait out the craving. There is no such thing as just one cigarette or just one puff. Avoid alcohol. Begin an exercise program and work on having a healthy diet to avoid gaining weight. Tobacco and health risks. Smoking cessation is an important step of achieving optimum health. Based on the result of the Global Adult Tobacco Survey of 2009, it is estimated that more than half of the world's smokers live in 14 countries, the Philippines among them. In 2009, among the 10 leading causes of death in the Philippines, 8 were associated with smoking. The economic impact is estimated at 1% to 2% of gross domestic product spent for tobacco-related disease, lost productivity, and death. The cigarette smoking prevalence rate of Filipinos aged 15 years and older was 28%. 48% of the male and 9% of the females were current smokers in the same year. In 2007, among students aged 13 to 15 years old, tobacco use have a prevalence rate of 22.5%. Boys have a prevalence rate of 23.4%, girls 12%. Among previously daily smokers, 21.5% quit smoking. Among current cigarette smokers, 60.6% report they would like to quit smoking. Smokers who are trying to quit experience withdrawal symptoms such as anxiety, increased appetite, irritability, and difficulty concentrating. These symptoms make quitting difficult, and most people will relapse several times before being able to quit successfully. Nicotine replacement, pharmaceutical alternatives, hypnosis, and acupuncture may be helpful in the attempt to quit smoking. The American Cancer Association recommends the following steps to quit smoking. Make the decision to quit. Any change is scary, and smoking cessation is a big change requiring a long-term commitment. Set a date to quit and choose a plan. Mark the date of your calendar. Tell your family and friends about the date and ask for their support. Get rid of all tobacco products, ashtrays, and lighters in your environment. Stock up on oral substitutes such as sugarless gum, hard candy, fruit, and carrot sticks. Decide on a plan and prepare to implement it. Register for a stop smoking class or see your doctor about nicotine replacement therapy or pharmaceutical alternatives. Practice saying no thank you, I don't smoke. Think back to your previous attempts to quit and see that what worked and what did not work. If you are taking bupropion or varenicline, take your medication each day of the week leading up to your quit day. Deal with withdrawal through avoiding temptation, changing your habits, walk when you are stressed and during breaks, use hard candy, carrot sticks, or gum to satisfy the need to put something in your mouth. If you feel the urge to light up, tell yourself that you are going to wait 10 minutes before giving in. Usually, the urge will pass within that time. Staying off tobacco is a lifelong process. Many former smokers state that they experience strong desire to smoke after weeks, months, even years of smoking cessation. This unexpected craving can be difficult to deal with. Remind yourself of the reason you quit. Wait out the craving. There is no such thing as just one cigarette or just one puff. Avoid alcohol. Begin an exercise program and work on having a healthy diet to avoid gaining weight. Alcohol consumption and health. Alcohol is very common in our society, and serving alcohol beverages is considered customary in social gathering. Heavy drinking is defined as consuming more than 2 drinks per day on average for men, or more than 1 drink per day for women. Binge drinking is drinking 5 or more drinks on a single occasion for men, or 4 or more drinks on a single occasion for women. Excessive drinking can take the form of heavy drinking, binge drinking, or both. However, those who should not drink at all include pregnant or trying to become pregnant women, people taking prescription or over-the-counter medication that may cause harmful reaction when mixed with alcohol, people younger than 21 years old, people recovering from alcoholism or are unable to control the amount that they drink, people suffering from a medical condition that may be worsened by alcohol, anyone driving, planning to drive, or participating in other activities requiring skill, coordination, and alertness. The Ottawa Charter for Health program, organized by the World Health Organization, The first international conference on health promotion was held in Ottawa, Canada on November 17, 1986. The charter signed during this conference called for a commitment to health promotion to achieve the goal of health for all by the year 2000 and beyond. The charter defines health promotion as a process of enabling people to increase control over and to improve their health, which requires that an individual or group must be able to identify and realize aspirations to satisfy needs and to change or cope with the environment. Health is a positive concept emphasizing social and personal resources as well as physical capacities. Therefore, health promotion is not just the responsibility of the health sector but goes beyond healthy lifestyle to well-being. The Charter identifies prerequisites for health and three basic strategies for health promotion: advocacy for health to provide for the conditions and resources essential for health, enabling all people to attain their full health potential, and mediating among the different sectors of society in efforts to achieve health. Five priority action areas provide support to these three strategies. Build healthy public policy. Health promotion puts health on the agenda of policymakers in all sectors and at all levels, directing them to be aware of the health consequences of their decisions and to accept their responsibilities for health. Health promotion policy is a coordinated action that combines diverse but complementary approaches including legislation, fiscal measures, taxation, and organizational change. Health promotion policy requires the identification of obstacles to the adoption of healthy public policies in non-health sectors and ways of removing them. Create supportive environments. Health cannot be separated from other goals. The inextricable links between people and their environment constitute the basis for socio-ecological approach for health. The overall guiding principle for the world, nation, regions, and communities alike is the need to encourage reciprocal maintenance to take care of each other, our communities, and our natural environment. The conservation of natural resources throughout the world should be emphasized as a global responsibility. Health promotion generates living and working conditions that are safe, stimulating, satisfying, and enjoyable. Strengthen community actions. Health promotion works through concrete and effective community actions in setting priorities, making decisions, planning strategies, and implementing them to achieve better health. At the heart of this process is the empowerment of communities, their ownership and control of their own endeavors and destinies. Develop personal skills. Health promotion supports personal and social development through providing information, education for health, and enhancing life skills. By so doing, it increases the options available to people to exercise more control over their health and their environments and to make choices conducive to health. Enabling people to learn throughout life to prepare them for all of its stages and to cope with chronic illness and injuries is essential. Reorient health services. The responsibility for health promotion in health services is shared among individuals, community groups, health professionals, health service institutions, and governments. They must work together towards a healthcare system that contributes to the pursuit of health. The role of the health sector must move increasingly in a health promotion direction, beyond its responsibility for providing clinical and curative services. Reorienting health services also requires stronger attention to health research as well as changes in professional education and training. This must lead to a change of attitude and organization of health services that refocuses on the total needs of the individual as a whole person. Moving into the future, health is created and lived by people within the setting of their everyday life, where they learn, work, play, and love. Health is created by caring for oneself and others, by being able to take decisions and have control over one's life circumstances, and by ensuring that the society one lives in creates conditions that allow the attainment of health by all its members. Caring, holism, and ecology are essential issues in developing strategies for health promotion. Therefore, those involved should take as a guiding principle that in each phase of planning, implementation, and evaluation of health promotion activities, women and men should become equal partners. Health education, health promotion, health protection, and risk reduction entails clients' deliberate performance or avoidance of particular actions. This performance or avoidance ensures that people are equipped with certain knowledge, skills, and attitude. The nurse is in a position to provide clients with both structured and unstructured learning experience to develop these necessary competencies. Health education is a process of changing people's knowledge, skills, and attitude for health promotion and risk reduction. Patient education usually refers to the series of planned teaching learning activities designed for individuals, families, and groups with an identified alteration in health. The effective nurse educator, based on Knoll's theory on adult learning, listed the following basic principle that guides the effective nurse educator. First is message, second format, third is environment, fourth experience, fifth participation, and sixth evaluation. Competency-based training of community barangay health workers. Primary health care has emphasized the role of the community in promotion, maintenance, and restoration of health of its members. An important aspect of the community in capacity building for health is the training of the community health workers. Community health workers embrace a variety of community health aides selected, trained, and working in carrying out functions related to healthcare in the community where they reassign their training does not constitute tertiary education. A generally accepted definition was proposed by the World Health Organization study group. Health promotion is an essential component of ongoing good health and well-being, yet many people have difficulty with one or more of the components of health promotion. Exercise, diet, sleep, and tobacco and alcohol use all affect our health. Nurses, particularly community health nurses, are in a position to assess and counsel clients on their health habits. Community health nurses also possess the unique combination of community familiarity and knowledge and training to impact health at the policy level. As the environment is made safer and more walkable, or with a lower density of available alcohol or fast food, the community as a whole will benefit. In addition to health education for health promotion and risk reduction for individuals and families to develop the community's capacity to deal with its own health needs and concerns, the nurse plays an active role in the training of the barangay health workers.